Thank you. Thank you very much, Congressman Mfume and Dr. Siv, and to all of you from Research America. Thank you very much, Dr. Siv, for your wonderful words and comments. I'm a great admirer of your work, your incredible research, particularly in the aspects of the brain, hopefully will lead to new breakthroughs, particularly as we ponder the inexplicable puzzle of autism. And I know that when I read about you, because while you were reading about me, I was reading about you, that you do a lot of work on frogs. And I saw tonight one of your pieces of jewelry is that of a frog. Well, let me say this to you, Dr. Siv. I hope to get you the money so that you can leapfrog ahead to find that cure or a way to manage autism. And to my good friend, Kwasi Mfume, we served in the House of Representatives together, and we've worked on when he headed up the NAACP as its chairman and CEO, and now in his leadership position with the National Medical Society. I'm a great admirer of Kwasi Mfume. He and I both came up in the streets and neighborhoods of Baltimore. We were unpolished, unvarnished, but we were unfettered in the way we wanted to speak and stand up for our constituents. But here we are, all well scrubbed up, and what I so appreciate about Congressman Mfume is the way he's tried to close the gap between the rich and poor, the way we work to close the digital divide to make sure children of minority families would not be left out and left behind, and his untiring work to close the health disparity gaps in the United States of America. I'm honored to receive the award at his hand. So to all of you, Research America, I'm going to thank you. Because for those of us who've been advocates for scientific research, whether it's for its funding, for increased policies, for the encouragement of young people to come into this field, we can't do it as public officials unless there's public support. I want to say hats off to Research America because of the work you've done yourself in research advocacy, but in building public support, explaining what we do as we pursue this. It's not about a line item or a category or an institute. It's really about the advancement of protecting and looking out for our people. And your work in public education, I think, needs to be really noted because it's in public education, both about research, about science, about prevention, about new ideas and new thinking that are going to lead this country forward. Mary Woolley and I were talking about China, and she said, our good friend, Dr. Francis Collins said, China is spending 26 something or other on research. And I said, I'm so sick and tired of hearing about China. And I'm going to say this to you. At a dinner that I had recently with Madeleine Albright, and we were talking to thought leaders like yourself, that as Dr. Albright, Secretary Albright said, you know, we can't stop China. We can only stop ourselves. So we need to stop fooling around and get our country focused again on what made the country great. And that means working together, the best of the best, each one of us being the best at what we're best at and the best that we're most needed for. For me, it's being a legislator. When I started out, or when I was a little girl, my mother and father took me to see a movie about Madame Curie. I loved it. It was the Greer Garson movie with Walter Pidgeon. Anybody of my age, you all know what I'm talking about. So I was mesmerized. I wanted to be Madame Curie, a woman of Polish heritage, as my family was, winning 2 Nobel Prizes, living in Paris. I thought this is the way I wanted to go. So at age 9, I got a little chemistry set and kept going. High school, pretty good. College, started out in science. What a bust. Unfortunately, I had no skill at it. Science was in my head, but not in my hands. I was klutzy and clumsy at it. So I say to you, I've turned out to be a better political scientist than a biological scientist. But the dream of that little girl about what it took to really find a cure, as they call Madame Curie, this is the 100th anniversary of her being the first woman to win the Nobel Prize. They call her the obsessive genius. And that's what it takes, to be obsessed about pursuing a goal, working to really find that discovery, to find that cure, to find that answer, to find that new element in the chemical table. And that's what all of you are here. And this is why my job, though I can't do science as well as I had one day dreamed, I can help those that can. And that's why I've worked so hard to join in a coalition with like-minded colleagues in the government to double the funding for research, to create the climate for research to be able to pursue what it needs to pursue without being micromanaged by those of us who hold elective office. And we've been able to do it on a bipartisan and nonpartisan basis. I want to salute the Goldwikers who founded this organization, the John Porters on this stage, the Tom Harkins, the Ted Kennedys, but the Arlen Specters as well. All of us working together for a common good and a common cause. And one of my proudest accomplishments is, as said in the introduction, is about women's health. I could not believe that in the mid-1980s, women were not included in the research protocols at NIH. And there I was in the Senate with only one other woman, Senator Nancy Kassebaum, a great and wonderful senator. And over there in the House, there were names like Pat Schroeder, Olympia Snow, Connie Morella, and we went out to NIH and we pounded the table. We were ready even to overturn the table. But what came out of that was that George Bush, the senior, appointed Bernadine Healy to be the head of NIH. And then on a bipartisan basis, Olympia and Sue and Nancy and all of us worked together with Ted and Tom and Arlen. And what do you know? We created the Office of Women's Health. Dr. Vivian Penn. Bernadine called me up, and John, you'd appreciate this about the president's budget being advisory. She said, I'd love to do a longitudinal study on women, but OMB won't give me the money, and I'm not supposed to be talking to you about it. I said, Bernadine, you've never talked to me about it. Why don't you yell, and I'll just say you yelled about it. And the end of the story was, again, working in appropriations with Tom Harkin and Arlen Specter, we quietly made sure that the resources were there for her to decide what should be studied. Well, you know the rest of the story. And I remember when Bernadine Healy was recovering from her own dreaded brain cancer, I called her up and we had a chat. I said, did you read the New York Times? Breast cancer rates, because of the change in hormone therapy treatment, has gone down 15%. I said, you know, Bernadine, because of the way we work together, we've worked to save lives 1 million at a time. Wow. So I tell you that story because, you see, I could go through numbers and statistics, but for me, it's always about the people. And I know each and every one of you, as you work in your labs, as you work in government affairs, as you work in making policy or regulatory frameworks and moving our country forward, for you, it's always about the people. And today, when I accept this award, I accept it because of not what I have done, but what I promise you I will do. I will work and continue to work for increased funding for the National Institutes of Health, for the National Science Foundation, for FDA, for all of the scientific agencies. We do need more money, and there are people in this country that need to bear the burden and pay the share to make sure we do that. And while we're working on more money, I want to do what I can to work with the kind of thinking presented by Dr. Collins and Dr. Peggy Hamburg here about how do we accelerate finding cures and the management of disease while maintaining safety and efficacy. The Cures Act, the Translational Help, and now most recently the Sprint Act. And I also want to do something about the pipeline. All over America now, there are young boys and young girls. They have the dream in their eye and in their heart that I had as a little girl. We need to make sure that if you want to study science, no matter what it is. If you want to be a clinician or a researcher, whether, regardless of what it is, you want to help people in your community, your neighborhood, and around the world, this is what we need to do. We need to close the pipeline so that we encourage people to come into the field, and when we get there, there is the money there for them to get the research grants and the other opportunities to be able to come up with the ideas that continue to save lives and make America great. So, I'm going to conclude because I know that I'm keeping you from your dinner, which I don't want to do. But I just want to say this in conclusion. I just love being an American. I just love it. But I'm not one of those chest pounders who say, I'm all for American exceptionalism, and then they want to shut down our government. I think if we're for American exceptionalism, let's all get in it together. Let's all work the way we've worked in a bipartisan, nonpartisan way. Let's forget about filibusters. Let's forget about trying to score partisan points. Let's stop forgetting about the next election and start thinking of the next generation. America is going to be exceptional because of the people in this room, the people in schools out there studying, people in Girl Scout troops, Boy Scout troops, at the kitchen table right now, tonight, dreaming about how to make America a better place. Each and every one of you already makes a difference. Together, we can make change, and may the force be with you. Thank you.